Hey everybody, I am excited to start offering case studies here on my social media platform. And we're going to start with Hawthorn today, which is one of my absolute favorite herbs and always is one of my best success stories with my patients. And that's important because the point of me doing this is to show both medical providers, herbalists, and patients and clients that all of these medicines can work together really well. And whether you are a medical provider or a patient, give you or your provider or patients ideas and ways that they could blend together. So feel free to use this case study as evidence when you go see your doctor, or if you're a provider that's looking to add some integrative therapies to your practice, Hawthorn is a really, really great and safe place to start. So let's get started. So here we have a 75-year-old female patient. She established care with me in 2022. Health history includes hypertension, coronary artery disease, and she is status post-stent placement. She also has prediabetes and depression. Right now, she's on metoprolol 50 milligrams daily. This is managed by her cardiologist. At her very first visit, her blood pressure was 150 over 78, and she was having headaches. We rechecked it at the end of our visit, and it was 138 over 80. We started out by just instructing her to check her blood pressure at home because sometimes it is higher at the doctor. She did message me and tell me that at home her blood pressures were running 170s over 90s. And we had her come back into the office for a blood pressure check, and we were getting similar numbers here too. At this point, we decided to start 5 milligrams of amlodipine between visits and to keep me posted as she was already doing on how it was going. Unfortunately, 2 weeks later, she sent me a message saying that even with adding the additional medication, her blood pressures were still 150s over 80s. In response to that message, also in between visits, we increased amlodipine to 10 milligrams, again, with telling her to keep me posted on how things were going. At our 1 month follow up, things looked a lot better. Her blood pressure had come down to 138 over 78. She was no longer having symptoms. She did tell me that her goal is to be off of blood pressure medications, and she actually had come to me hoping that I would help her with strategies to remove these medications that she was taking. So, because of that, we decided to start a high dose of Hawthorn blend tincture, 90 drops 3 times a day. And we talked about some weight loss strategies to help with blood pressure as well, but we did not make any medication changes. A little bit of a sidebar, she also told me at this visit that she has been taking licorice tincture for acid reflux. And as a lot of us herbalists know, licorice and blood pressure do not mix. The only acceptable kind of licorice for folks with hypertension is DGL because it has the alkaloids. Taken out of it, they can increase blood pressure. So this is when things started to really change for her. At her 2 month check-in, her blood pressure was down to 128 over 70. She had been compliant with her Hawthorn, all of her meds, and she had made some changes in her diet too. We did not change any of her meds or her herbs at this point, but we added some blueberries for antioxidant support. So a few weeks later, I got a call from her saying she was experiencing some bilateral swelling in her legs, which most of us know can happen with amlodipine. So we decided to cut the amlodipine back from 10 milligrams to 5 milligrams, but also, of course, to let me know if she saw a blood pressure spike with this change. Quite to the contrary, though, at our 3 month check, her blood pressure was down to 128 over 68, and she was still taking her Hawthorn, and she had even lost a little weight. So, with permission from her cardiologist, we decreased her beta blocker, her metoprolol, from 50 milligrams to 25 milligrams daily. So in another 2 months, her blood pressure was down to 124 over 68. So we kept going down on the amlodipine, bringing her down to 2.5 milligrams and maintaining her on her dose of metoprolol. She did let me know that she was only taking the Hawthorn once a day at this point, which I think was a misunderstanding. So I had her go back up to 3 doses per day till we could continue her goals of weaning off meds. So at her 6 month follow up, she let me know that her cardiologist had actually made the decision to wean down on her beta blocker to 12.5 milligrams daily. Her blood pressure was 132 over 66, and she had been doing so good adhering to her herbal regimen that we decided to take off the amlodipine altogether. When I saw her this month for her annual wellness check, her blood pressure was 126 over 76 on just 12.5 milligrams of metoprolol and 90 drops of Hawthorn tincture 3 times a day. I let her know that from a blood pressure perspective, she was good to go off her metoprolol. She's going to confirm this with her cardiologist, however, because sometimes in folks that have stent placement, beta blockers are actually started in response to the coronary artery disease and not just for hypertension. A couple key takeaways I want to highlight from this case is that patient safety is always the cornerstone of any protocol that we're putting together. These are tough conversations that we often have to have with our patients, but sometimes it has to be medication first, herbs and lifestyle second. I find that if I can phrase this as a safety consideration and that I'm doing this because I care about them, they will give me the time and space that the herbs and weight loss and diet changes need to work, which can sometimes happen quite slowly. Have we seen in this case that it took months for the Hawthorn to really start kicking in, and then we saw things escalating fairly quickly. And patients should always be kept at the center of the plan. Notice that I did not bring up starting herbal therapy with this patient until she brought it to my attention and we had her stable. So follow the patient's lead. If they want to do things with medications, great. If they want to do things with herbs, as long as it's safe, then this is the time that we can start experimenting with some of these therapies. Also of note, Hawthorn can be safe in virtually any heart condition. It's our trophorestorative family of plants, meaning we can use them in high doses just to support the overall function of an organ. However, patients who are also on beta blockers might get some bradycardia and hypertension or lightheadedness, so they really need to be in conversation with their provider about this. Licorice tincture, sidebar again, not very effective for acid reflux. It really should be a preparation like DGL that actually touches the mucosa and the throat. Guys, thank you so much for attending this week's case study. My plan is to start doing these regularly. If you guys have any questions or comments, drop them below. Don't forget to follow me for more great info, and I'll see you guys down the road.